Learning points are issued after each sitting of the registration assessment. They are available in the Pre-Registration Trainee Pharmacist Manual on the GPhC's website. After a sitting of the assessment, the Board of Assessors considers carefully what topics a cohort has performed less well in and provides this feedback to guide future candidates. You should therefore use this cohort feedback in your preparation. In the next slides, a number of issues highlighted by the Board of Assessors are described, but please do look at the full feedback on our website. Also on our website you will find some examples of questions from the registration assessment. These questions are provided to help you in your preparation, and we will take a closer look at a couple of these and describe how you can use them to help you prepare. The Board of Assessors have previously highlighted that they expect candidates to know appropriate doses for patients of different ages when recommending common non-prescription medicines. For example, do you know the dose of paracetamol to recommend for a 5-year-old child? Or the dose of paracetamol to recommend for a 4-month-old baby having childhood vaccinations? Are you aware of MHRA advice in relation to common medicines? For example, are you aware of restrictions on the use of codeine in children? And importantly, do you understand the reasons for these restrictions? Are you up to date in your knowledge with the monthly drug safety updates from the MHRA? More examples of feedback from the Board of Assessors include understanding principles about the routes of administration of different medicines. For example, knowing that vinca alkaloids are for intravenous use only. Knowing when a patch formulation may or may not be indicated for a particular patient. Knowing what sources of evidence are considered most robust when assessing a new medicine. Something that we observed last year was some confusion around when to round numbers in pharmacy calculations. Firstly, normal mathematical rules apply to pharmacy calculations. However, it is necessary to consider carefully what is being asked in a particular question. For example, if calculating an individual dose of a medicine that is available as a capsule and then working out a total quantity to supply for a 28-day period, it is necessary to round the individual dose. A patient cannot take, for example, 2.1 capsules per day. The dose must be rounded and then a total quantity calculated. If the rounding occurs at the end, then the wrong total supply will be calculated. When to round in a pharmacy calculation therefore depends on the situation. Do you know how to recognise an adverse drug reaction? Do you know what would be classified as a serious adverse drug reaction? And do you know how and when ADR should be reported? The example questions on the GPhC's website are there to help you with your preparation. They are not intended to represent the breadth of the assessment framework, but to provide you with ideas and guidance. This is an example of a single best answer type question from Part 2 of the assessment. It is expected that trainees will be aware of the current guidelines for the treatment of hypertension, a common condition, and be able to optimise therapy for an individual patient. When preparing for the assessment, it may be useful to think about different patient groups. For example, what if this question was about a 45-year-old of Caucasian family origin? Or about a frail 91-year-old with multiple comorbidities? How would these factors have affected your therapy choice? This is an example of an extended matching type question, again available in the examples on our website. This question focuses on the treatment of postherpetic neuralgia and the side effects of common analgesics. But do you know the range of indications for all the drugs listed A to H and the common side effects of each? Do you know what patient factors can affect choice of analgesia? In other words, use the example questions on our website as an opportunity to learn more widely. If you have any questions about this or any other aspect of pre-registration pharmacist training, please look in the manual on our website and if you cannot find the answer you're looking for, then please do contact us.